distinguished guests, colleagues, and dear students. Good morning from Washington. It's a privilege to join you today at a gathering where geography meets global health and where our shared understanding of place, space, and people can help shape a healthier, more sustainable future for all. My personal gratitude to Professor Prashad, Principal of the College, Professor Khan, HOD Geography, and Dr. Sanadhya, Convener, for the kind invitation and honor to share my thoughts at the inaugural of this international conference. I see the conference topics transcend borders, generations, and ideologies, particularly as it intersects with the pressing need for sustainable development. The health themes chosen for the conference are contemporary, relevant, and futuristic, and deserve an academic discussion for deeper understanding of emergency, physical and mental health challenges, and failing access to health care. Let me begin by outlining the health and disease landscape we face. Briefly, three health-related issues of non-communicable diseases, environmental health, and inequality in access to quality health care required immediate attention and action. Rapid urbanization, lifestyle changes, environmental risk, coupled with demographic and epidemiological transitions, have facilitated the upsurge of non-communicable diseases like diabetes, cancer, and cardiovascular. India has become diabetic capital of the world, with heart and cancers occupying top ranks in mortality profile. Mental health, unfortunately, has been pushed to the periphery of health agenda. Depression and anxiety are now among the top contributors to the global burden of disease. Yet services remain underfunded and stigmatized. Environmental health issues are now among leading causes of death and disease burden worldwide. With unmanaged and haphazard urbanization, indoor and ambient air pollution related chronic respiratory, cardio, and circulatory diseases are rising globally. More people cook with solid fuels today in India than the total Indian population in 1980. Indoor air pollution exposes women and children more in rural and poor urban settings while using solid fuels. We cannot separate human health from the health of our planet. Rising temperatures, air pollution, food insecurity, and natural disasters are all public health crises in disguise. A warming planet increases the spread of vector-borne diseases and undermines food and water security. Whether it is heat waves in southern Europe, floods in Southeast Asia, or drought in sub-Saharan Africa, climate stresses are multiplying health threats. These changes are deeply geographic and demand localized, climate-resilient healthcare planning. To respond to the rapidly rising NCD's cure, the public health system is abysmally inadequate and underfunded. Conversely, the private health sector, although provides quality services, remains financially inaccessible to those who need them most. Phenomenal cost of treating NCDs is pushing marginalized families to a new form of health debt trap and poverty syndrome. Health inequities, often rooted in poverty, geography, and systematic discrimination, continue to marginalize the most vulnerable populations, including women, children, elderly, indigenous communities, and those living in conflict zones. Considering rise of NCDs and cost of healthcare, universal health coverage, an important sustainable development goal, has not moved from a vision to a reality and has remained the last achievable goal across poor economies. So where do we go from here towards improved health and well-being? Preventive and promotive health models and approaches are considered cost-effective and environmentally sound alternatives. WHO and other health organizations, including academic disciplines, are taking lead in promoting such approaches. When we talk about global health and sustainable development, we often speak in terms of systems, statistics, and strategies. But at its core, global health is about people and place, because geography shapes our health outcomes in profound ways. As geographers, we understand that where you are born, live, play, and work shape our health and well-being. In other words, place and geographic settings matter in causing and preventing diseases. Geographers look into health issues that how space and locations mediate in a holistic way to understand the interface of environmental and human factors towards health or disease generation. They also examine how disease spread in space through transport networks, migration streams, and other spatial movements in cities and beyond. By 2050, two-thirds of humanity will live in cities. Urban geographers must help reimagine cities that support mental health, physical activity, clean environments, and equitable access to care. Using geographical approach, promotion of environmentally sound and healthy cities or settings became a flagship program of WHO in the 90s. The speaker, as an urban and health geographer, had the opportunity to be associated with WHO for almost 20 years to promote and implement this concept in selected cities across Southeast Asia. The initiative, which involved the neighborhoods, mayors, and civil society groups to work on communities' environment and social health issues. We discussed solutions with participatory approach and used geography tools like remote sensing, GIS, digital mapping, and spatial planning to identify environmental health issues in a setting. There are several real-world examples to replicate now. So what is our shared call to action? Let us integrate health equity into every map, every spatial model, every policy we influence. Let us break silos between disciplines and between ministries, from health and transport to education and housing. Let us push for geography-informed health policy and health-informed geography curricula. In the context of sustainable development, we face a pressing reality. The global burden of disease is increasingly shaped by social and environmental determinants, which are deeply tied to geography. In closing, the challenge before us is not just to chart the world, but to change it. A healthier, more equitable, and sustainable world is possible, but only if we understand where the challenges lie and work together to reimagine the landscape. With these words, I thank you and my best wishes for the wonderful success of the conference.